Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wondered what causes that sore throat and difficulty swallowing? It could be tonsillitis, an infection that targets your tonsils. You know, those two masses of tissue at the back of your throat that act like a first line of defense, catching germs before they can go any further. When they get infected, they can swell and cause quite a bit of discomfort, even making it hard to swallow. But what exactly causes this uncomfortable condition? Let's dive in. Tonsillitis is primarily caused by viruses and bacteria. These microscopic troublemakers invade and inflame the tonsils, those two oval-shaped pads of tissue at the back of your throat. One of the most common culprits is a bacterium known as Streptococcus pyogenes, or Group A Streptococcus. This is the same germ that's responsible for strep throat, a condition that can accompany tonsillitis and make you feel even worse. But bacteria aren't the only cause. Many viruses, including the common cold or flu virus, can also lead to tonsillitis. And let's not forget that tonsillitis is contagious. It spreads through airborne droplets when someone who's sick coughs or sneezes. You might also get it by touching a surface where these droplets have landed and then touching your mouth or nose. So it's clear that these tiny organisms are quite effective at causing big problems. Now that we know the causes, how do we recognize tonsillitis? Tonsillitis symptoms can vary greatly, but generally include a sore throat and difficulty swallowing. This discomfort can be accompanied by swollen tonsils, which may appear larger than usual, often making swallowing even more challenging. Now, if you take a peek at your tonsils and they appear red, or there's a white or yellow coating, it could signal an infection like tonsillitis. Another common symptom is painful blisters or ulcers on the throat. These are not just uncomfortable, but they can also make eating or drinking a painful task. You may also experience changes to your voice or even a loss of voice. This happens when the inflammation of the tonsils affects the vocal cords. In addition to these, you might also experience headaches, ear pain, and even bad breath. Fever and chills, along with a loss of appetite, are also common. If you're experiencing these symptoms, how can you be sure it's tonsillitis? To diagnose tonsillitis, a healthcare provider will start with a physical exam and ask about the symptoms. They may check your throat, listen to your breathing, and look for signs of a throat infection. It's common for them to use a lighted instrument to get a better look at the tonsils. In some cases, a throat swab or blood test may be necessary. A throat swab involves gently swabbing the back of your throat to collect a sample for testing. Blood tests can help to rule out other conditions that may be causing your symptoms. Now let's talk prevention. Regular hand washing is crucial, as tonsillitis is often spread through hand-to-mouth contact. Try to avoid close contact with individuals who are sick, and don't share personal items such as toothbrushes or drinking glasses. Remember, prevention is better than cure, and these simple steps can go a long way in keeping tonsillitis at bay. So you've been diagnosed with tonsillitis. What now? Treatment for tonsillitis will depend on the cause. When it comes to dealing with this condition, there are several options available. If you're dealing with a viral infection, for instance, your best bet is often to rest, stay hydrated, and manage the symptoms. This might involve gargling with warm salt water, using a cool mist humidifier, and taking over-the-counter pain relievers to soothe a sore throat. If your tonsillitis is bacterial in nature, your healthcare provider will likely prescribe antibiotics. It's crucial to take the entire course of medication, even if you start feeling better, to ensure the bacteria is completely eradicated and to prevent complications. In severe or recurring cases of tonsillitis, a tonsillectomy or surgical removal of the tonsils might be recommended. This procedure is considered when tonsillitis is causing major health problems, such as difficulty breathing or swallowing, or if it's leading to frequent bouts of strep throat. The recovery period for a tonsillectomy is typically about 2 weeks, and it's important to follow your healthcare provider's instructions for care during this time. Of course, treatment should always be guided by a healthcare professional who can assess your symptoms and make a diagnosis. They can also provide advice on how to prevent tonsillitis from recurring, including practicing good hygiene and avoiding close contact with people who have the infection. Remember, it's important to seek medical attention if you're experiencing symptoms of tonsillitis. Stay healthy. UMCC, your ultimate medical consultant connector.